this year in Easter, I ended up in St Albert Hospital. I spent 8 days in the emergency ward. I spent 8 days before I got a bed.
I think the most important thing in this fight is that we are fighting to establish that we as human beings are not a cost to society. Our old people are not a cost to society. Workers are not a cost to society. Healthcare is a right.
I want to say that I'm scared about healthcare in our province.
Alberta, SOS. It's life and death.
There's a lot of people who have said, no, there is nobody that'll fight for us anymore. So many people have given up. Now, at least we can speak up and we can give our voices. And I thank you all for giving us that chance.
It's difficult sometimes for us to appreciate the difficulties that are associated with these public health care battles. And as I travel through the province, I hear so many different stories from different towns and cities and small towns and countryside. Everybody has the same thing in mind, which is to not just preserve what they have in their public health system, but to make something better for the future.
I am optimistic these days about healthcare in Alberta because it appears that with a couple of press releases, we can magic away nursing shortages. And with the wave of a magic wand, we can make acute healthcare bed shortages disappear.
Number one, we should be proud as heck about our system. We should be so proud of our system. So it's not perfect. It's not perfect. But what was the alternative? Well, the alternative was that we could have had the US system. In Canada, we had exactly the same system as the United States until Tommy Douglas started us off on our path to Medicare in the 40s.
The path that we're on right now is one where political whims are driving decisions about funding, decisions about staffing levels, and decisions about access. Not solid goals on what our health outcomes should be.
Up until the early 1960s, when we had pretty much the same health system as the US, we spent the same amount on health care. Now, once we bring in Medicare, look what happens to those lines. As soon as the system is fully in place in 1971, the lines splay. And now the forecasts are for 2009, the US is going to be spending well over 16% of their economy on health care, maybe 17% plus, and we'll be at around 11%. That difference in spending amounts to almost $100 billion. That's how much money Medicare saves us.
So why would we trade off our excellent healthcare outcomes in the public system for worse outcomes, a higher chance of dying after surgery, and a more expensive surgery? Because we have to pay for it either way.
When Medicare couldn't be implemented the way he saw it initially, all his life he talked about the second stage of Medicare, how that the original vision of Medicare was going to have to be going beyond simply paying for the care provided to sick people. Really, the second stage of Medicare, in my view, is all about something else in healthcare, which sometimes is referred to as the quality agenda. Which goes back to we aren't delivering the quality we should, not because the values of Medicare are a problem, and not because most doctors and nurses and other healthcare providers aren't dedicated people, they are, but because the system we set up to deliver care is inefficient. It dates back 100, 150 years. It's that old professional model from the 19th century that I'm a great man, doctor, I sit on a chair, you come and approach me, and I tell you what to do. That's not how we understand quality healthcare should be delivered these days. Just as an example, you know, that about 1/5 of women over the age of 65 in Canada are taking long-term Valium, well, benzodiazepines, Valium-like drugs. That is very poor quality care. That's not what Tommy Douglas had in mind. That's what happens when you have a fee-for-service doctor in an office without social workers or other people who can provide counseling, and there's a drug rep coming into the office every day saying, prescribe drugs, prescribe drugs. That's not Tommy Douglas's vision.
seems like Ron Leipert has said that public funding is one thing, and we seem to be sort of gaining some ground in terms of that battle. But on the private, but he said, we'll keep it publicly funded, but we'll move towards more private delivery. I'm not quite sure what problem this solves. Either we pay out of our pocket, or we pay through the public system and we pay the private profit provider through our public tax dollars, so we can get worse outcomes at more expensive costs. So I wanted to hit that one hard because this seems to be the path the government's really focusing on now, is let's move down the path to private delivery. And it's absolutely, in the data, consistently the wrong way to go.
There's great evidence to show that for-profit healthcare tends to be of poor quality and tends to cost more money. I'm not saying every single example would be that way, but the best studies indicate this from some of the best researchers in the world. But I find, if you could fix every single problem in our health system with not-for-profit public solutions, if you in Alberta, because of your spirit of innovation I see in this province, if you've got all these wonderful programs that could fix all these problems, if you could bring long-term care and home care and pharmacare into your system instead of throwing those away and cutting your hospital system, why wouldn't you do it? So I think the best argument against going private is Tony Soprano's. Forget about it. You don't need it. I'll close with something in Tommy's spirit. The Friends of Medicare, you prove it all the time. Yes, we can.